Good evening. Welcome to another episode of Aging with Attitude. My name is Phil Koch. I'll be your host this evening. Tonight we have Jennifer Reid, who's the client and brand development with Griffin Home Healthcare, a durable medical equipment company, otherwise known as DME company, correct?
Yes, correct. Thank you, Phil, for having me tonight. Really appreciate it. Yes.
It's great to have you. I know Jennifer from the industry and she's well known. It's great to have her on the show.
Thank you so much.
First of all, I want you to talk a little bit about the acronym DME and what that means.
Okay, so DME stands for Durable Medical Equipment, and I think people associate that with having to have a physician's order or a prescription from the doctor, and you necessarily don't have to have a prescription to obtain or order DME. So that's probably one of the misleading things is people think in order to go to a DME company, you have to have a prescription, and that's not always the case.
And you don't or do need a physician to order the DME?
Certain products you do and certain products you don't.
Okay.
DME has changed over the years, but like, for instance, an example would be like a bath or shower chair. That's considered DME, but you don't need a prescription to come into our store or showroom and purchase one.
Okay.
Yeah.
Okay. And I know there's lots of a huge array of DME products.
Yes.
Massive array.
There's a massive array. And new technology is always coming up with better stuff. And so it's a enormous learning curve for anyone who's new to DME, like myself. It's some equipment's very complicated, especially if you get into more of the oxygen or respiratory equipment. Wound vacs or negative pressure is what it's known in clinical. So any kind of wound care or respiratory, that can be very complicated.
Right.
Mm-hmm.
But I think it's important to say to the families too, and that is, if you have a loved one in a hospital, skilled nursing agency, or rehab center, and they're about to be discharged,
Right.
99% of the time there is a social worker that will help you navigate this, correct?
Yes.
On what needs to be ordered, and will then reach out to the DME company.
Yes.
Right?
So there's different scenarios.
Okay.
So like if you want to use the hospital as an example,
Okay.
you will have a discharge nurse or a social worker or a case manager. And there's lots of acronyms and different, that's I think the big confusing thing is every hospital, every doctor's office, they do things different. It's not really always a consistent mainstream approach, especially when you're discharging from a hospital. I think they try to be consistent with a discharge nurse and then giving you a social worker and then a case manager. But there's different people coming in, discussing with you how you're going to go home from this point, what you're going to need, who to go get it. They always give the patient the choice of different DME providers. And, you're just either had surgery or you're recovering from a fall or you're sick. It's, a very difficult time for you right in that moment. And then you have to make all these decisions. And if you've never been, in that situation before, if you've never had that problem, you really don't know. So the social workers and discharge nurses will help you. They do give you choices of where to go if you've ever used anyone before. And if you haven't, then they'll make recommendations on different DME providers. And that's where I feel, my role as client and brand development, going out and educating all the social workers and nurses that Griffin is here. We do care. We want to help you with that process of discharging those folks home.
Yeah, and that kind of leads into the next point, that, and that is how the evolution of DME, and again, we're going to use that acronym a lot tonight. DME stands for Durable Medical Equipment.
Correct.
Medical equipment or supplies. But how has the evolution of that industry changed, and how does that affect our clients and their families at home?
Well, I'm not an expert quite yet. I've only been doing this for about 10 months, but in the short time that I've been exposed to this, from my perspective.
Sure.
Now, in the past, I have used DME for my son, but as far as being in the industry and hearing and listening to all the different people I meet, from clinical to patients to customer service to also reading. I mean, I've been trying to do a lot of reading, especially with the HME magazines, and then just going on Medicare's website and reading that stuff. It is evolving, and unfortunately, I don't think it's evolving to the point where patients are going to benefit from it, and that's the sad thing. In the short time I've been doing this, the one thing that I have realized is not only is it confusing for patients to figure out how to get their DME, sometimes with your older population that are using their Medicare benefits, they might have to go to different DME providers just to get what they need for that one incident. And that, I think, is, can be really frustrating and challenging. And my heart goes out to those folks. And
right. It's hard.
But
in a nutshell, correct me if I'm wrong.
Right.
So the DME world prior to a couple years ago was you could go to one provider and they could provide everything.
Correct.
Could be up to thousands of different products if you so needed. Most people wouldn't need that many.
Right. Hopefully not.
Hopefully not that
Yeah.
good. But if you did,
Right.
you could get it from one provider.
Yes, and we had, and we still do, but Griffin's been around for 33 years in Charlotte, and so we've had a long relationship with an enormous amount of folks.
Yeah.
And unfortunately, they've gotten to know us, we've gotten to know them, their family members know us.
Sure.
And with competitive bidding, it has changed how we do business with them. And it's not our choice, it's how healthcare reform has changed things.
And that's kind of leading into, why don't you talk about what happened in general, and I can help here.
Yes, please help.
Okay, all right, maybe I'll help. So in competitive bidding, DME companies through Medicare
Correct.
had to come in, and Medicare said, we're going to take certain target cities, and Charlotte was one of them.
Correct.
And we are going to allow the DME companies to bid outright against other DME companies. Some DME companies weren't even in the Charlotte market at the time, but were allowed to bid
Correct.
for certain product lines. So instead of having one company be able to do all type of products, now they're going to say, you have to bid for all those product lines or the ones you want to carry. If you win, you can continue to carry that line, promote, and sell it under Medicare.
Correct, for the Medicare patients, exactly. And with what you just said, what stands out to me, just as a person and just in the public, is companies could bid.
Right.
A DME company could bid, but the flaw there is they didn't have to be in that city.
Yeah.
They didn't have to have brick and mortar in that location.
Yep.
So anybody could have went and got a DME license, someone behind a computer, and bid for all these items, and some of that did happen, unfortunately.
Yeah.
And what happens is the companies that have been doing great business and have been serving the community, the Medicare community, for years and years, here they, really did legit go through and bid accordingly to what they could do and how they could service and take care of the patients, and they didn't win the bid.
Right.
So
Even
now
some of the bigger companies, which was a surprise, right?
Yeah. And so, like for instance, mobility. Griffin Home Healthcare has been known for walkers and wheelchairs and rollators for 3 decades.
Right.
And now we have tons of Medicare patients or customers that come in, and we cannot go through Medicare and give them that product anymore.
So you'd have to turn to another company and say, reach out to them because they won the bid for that product line.
Yeah, if they want to go through their Medicare benefits and have Medicare pay for their equipment when it comes to mobility, and we're using that as an example, walkers, wheelchairs, rollators, they can choose to purchase it from us and pay out of pocket, or we would work with another DME provider, or we would just let them know, based on Medicare, this is who you would need to go to
Right.
with your prescription and have them file through your insurance.
Yeah, very good. But Griffin is extremely high quality, well-known company in this industry with a great reputation, and the owners are very well known in the Charlotte community.
Yes.
So it's great.
That's why I chose to go work for them.
Great.
Yes. Yeah, I actually used Griffin. I have a son that has special needs, and I used Griffin years ago, almost 12 years ago, for my own son's durable medical equipment. And I've used other DME providers in Charlotte, and by far, Griffin gave me the best customer service, and everything just seemed to go real smoothly with billing. They were willing to work with me, and so yeah, that's why I wanted to work for them.
Wow. So going back to the Medicare piece,
Yes.
For those people, I know they're asking, so, and I know there's a lot of different product lines that are out there, but what percent, it can vary, right?
Mm-hmm.
But roughly, what percent does Medicare pay that, and then the client has to pay out of pocket? Does it vary according to the product line for DME?
I'm not an expert in that because I don't handle the insurance side of it.
Right.
And I'm just still learning the whole industry itself. But based on the experience that I have so far,
Sure.
Some people will have Medicare and then a supplement or a secondary insurance.
Right.
And so that will maybe help with the payment of it. Some people with Medicare have deductibles still. They're low deductibles, but they still have them. And then, some have met their deductibles. They want to, get a product that their doctor, or a piece of equipment that their doctor has suggested or recommended, but then they might not qualify.
Right.
So that's the other piece of it. It's not just can we
have to qualify.
bill
Yeah.
for their Medicare benefits. Do they qualify?
Right.
And then there's rules. And see, this is where it gets so, complicated.
Yeah.
For mobility, and I'll just use that as my example through Medicare. My mobility, there's a 5-year rule. So.
Sorry, again.
Yeah.
Define what mobility is. What you're.
Mobility is walker, wheelchairs, rollators, anything that helps you, equipment-wise, stay around, and keep you safe. There's a 5-year rule for Medicare. So, sometimes so they'll get a walker and they go through Medicare to get their walker, and say 3.5 or 4 years into owning their walker, they might want something else, or they might need something else.
Right.
That can be challenging. I'm not saying they can't get it, but it gets very challenging. And sometimes they have to wait that 5 years. Okay. Or if their walker is not really, they want a rollator. The rollator's kind of seen, they've already been given a walker. So most of the times they'll end up paying out of pocket privately for their rollator.
Right.
Because they're not quite past that 5-year mark.
But it's clear to say, correct me if I'm wrong, that a healthcare facility or community, like a hospital, like a skilled nursing facility,
therapy departments,
they will have departments that will help walk through somebody who's being discharged, and a social worker that will navigate most of this for them, and will reach out to companies like Griffin Home Healthcare and say, do you have this? Are you able to supply that? If not, here's another company that can provide it as well, right?
Yes, and that's where I try to focus the most on our role in the DME industry. Mm-hmm. One thing I want to do is set us apart from others is going and building those strong relationships with those social workers and with the case managers. And the way to do that is really just being involved in community outreach, attending their events, and learning about their industry and learning about their role and how they provide service. And the more I can learn, it will help Griffin, because I'll go back to our customer service, I'll go back to intake and be like, this is what's happening, this is how we're gonna help them make their, help their process, help them give the level of care that they really want to give to their patients. And so it's, we're all having to work together.
Yeah,
there's many different moving parts, and Unfortunately, the patient, it's very overwhelming because, again, they just had an incident. They're probably not feeling well. They might be in some pain. They might, not be in the right mental state. And then they've got to understand all this different stuff. I mean, that to me is, probably one of the biggest challenges.
And it changes.
Every
couple of years, it could be a new law through healthcare reform that could make changes to the industry.
Yes, and every 3 years, as of right now, competitive bidding will change. So for this round, they call it round 1. For right now in round 1, Griffin Home Healthcare did not win the mobility bid.
Okay.
But we are bidding for it, and so in round 2, which is 2017, we could service the Medicare population for mobility.
Right.
Now, how confusing is that?
Right.
So we've told people for 3 years we cannot, that you'll have to private pay if you want to purchase any mobility for that particular category. And now we're saying, oh, now we can. I mean, to me, that's just making the landscape of DME just unstable, to be honest with you. It's very unstable.
And this is throughout the United States.
Yes.
It's not like it just so happened Charlotte was one of the pilot cities that started the bidding process. So as you mentioned, round 1, and I think as prior rounds go, more product lines are added to the bidding process, no?
Correct. I believe you are right in saying that. I think, again, that would be more more executive decisions. I really don't know. Richie Griffin is the one that makes those calls. But I believe what I've read is that, yes, more product line are being introduced. They are listening. I will say, one thing that I would love to, pass on to your audience is please say something. Write your local, government and just let them know your situation. I think the more data and information they get, it might help them with understanding how to go forward and how to make maybe accommodations. For instance, I'll give a perfect example. Medicare, when they came out with this, they said MDs had to sign off on prescriptions and also I think on clinical notes for certain, so like you're working with a nurse from skilled nursing or whatever, and the nurse practitioner is the one that mainly is with them and always seeing the patient. What they had said was in the beginning, MDs had to sign off on all that paperwork.
Right.
But the MDs are not always in these retirement communities or rehab facilities. And so that there's a lag in care there, because if the MD can't get the signatures on this equipment, then the patient's not getting it. So now, and this is something that we had to go back and look at, for right now, they are allowing nurse practitioners to sign off.
That's good.
But we didn't know that.
Right.
And so, there's just a lot of miscommunication.
Yeah.
And that, I think, is unfortunate. So how can we mainstream the communication, and how can Medicare really, summarize things in a little bit more layman's terms to help with the internal processes so the patient can get their equipment?
Do you think that there'll be changes in how competitive bidding goes going forward?
I hope so. One can only hope.
Right.
I mean, I really feel like there needs to be changes in a more positive way, where the patient is not, one, having to go to different DMEs for all these different categories. And I'm hoping that they can have more of a clear message on, is it the MD, is it the nurse practitioner, what are some of the things that they're going to allow, because that's the other thing. Reimbursement for medical equipment keeps going down and down, which unfortunately that's going to affect the patient, because when reimbursement goes down more and more, and then you only have 1 or 2 suppliers being able to service that category like mobility, unfortunately I feel that the patient is in the end going to be the one that's really going to suffer from all that.
Right. So in a nutshell, what the cabinet in Washington wanted to do was to create a bidding process to lower the overall cost of healthcare, which in that is a good thing.
Right. I understand why they did it.
Right.
I just don't think they really understood
Exactly. I
how
agree
to
with you.
do it.
Yeah. Because what happened was it affected supply and demand and flexibility towards the consumers at the end.
Right.
Yeah.
Exactly. And I mean, Medicare fraud was a real issue out there.
Yeah.
And I understand it. And, but when you take a company that has brick and mortar and been around for 33 years and you've audited them and you haven't found anything and there's no Medicare fraud, I think they should be excluded from the competitive bidding, to be honest with you. They've proven over time that they are a legit company that is, especially family-owned company, that, the Medicare population is our bread and butter, and we really needed them. And to lose that, or certain categories, or not to be able to project our future, we can't even really do any forecasting when it comes to the Medicare population.
Right.
That's really put us, a really honest, legit, family-owned company, in a bad situation.
Yeah. All right, let me ask you this.
Yeah.
If Mrs. Smith is home right now and she's thinking about her husband who's getting worse, living at home with her,
Right.
and she thinks she needs some oxygen, maybe even a hospital bed.
Right.
Well, she's not going to call the hospital right now because he's discharged from the hospital a long time ago.
He's already at home.
So he would call who?
I would recommend, and we work with other providers in the area that do different services, and we have kind of a marketing area that we know that these people have taken good care of folks, and so we would recommend either an advocate, maybe a nursing, a home care agency.
Right.
And then we would ask them, different hospitals have their own case management, see if they're working with one of them, a case manager, and just try to communicate with that third party to see what the needs are of that patient and how we can help with them.
Could they call up somebody like a Griffin Home Health and say, I'm thinking I might need a hospital bed or oxygen, but not really sure?
Yes.
Would you be involved, or your company be involved, or somebody like you?
Yes, our intake department would work with them on what are the qualifications, to even see if they is worth going to the doctors to see if they should get a prescription.
Right.
And you don't necessarily have to have a prescription for a hospital bed. You do need a prescription for oxygen.
Yeah.
Anything respiratory does require a prescription.
Okay. So things that pay for this is Medicare, obviously, depending on the product, right?
Yeah, Medicare doesn't always cover all products.
Right.
And that's the other thing. I think folks think, okay, I've reached an age where I can start helping, Medicare can help me, and then they might have, certain wants or needs, and that doesn't mean Medicare will cover it. They can still get it, and we'll work with them on different options. You have your low to mid to high grade equipment, and we'll work with them and we'll try to see where we can best suit them. We'll ask them more questions. We'll make sure, is it really something they really need?
Right.
Or do they need it right now? Maybe it's something they might need later on.
Right.
So those are the things I think that, having knowledgeable, friendly customer service to help ask them questions and to listen to them really makes a big difference. Because you can go to any store now and buy a bath shower chair, pretty much, like the big box stores.
Right.
But I think what sets us apart is we're going to ask you, and we're gonna, people don't realize bath chairs, for instance, you need to have a certain bath chair for your height and weight.
Right.
You might not know that, and you think you're going to get a bath chair, so you'll go to a big box store, buy one, and then you go to sit on it, and it might break because you didn't have a customer service person ask you those questions. What's your height and weight? Okay, this is what you should be looking at.
Right. Is a person in diabetic?
So.
Is a person, a certain height and weight? Which
can you get in and out of your shower? Are you going into a bathtub? Those types of things. I think that sets us apart. And help educate. I think education's the main thing.
Yeah.
We need more education on durable medical equipment for sure.
And sometimes, and correct me if I'm wrong, and this is something Griffin can do, is if somebody says, well, I need this set up for my house for my husband or my wife, you can help supply the products, but you can also provide a vendor who might be able to modify the house
Correct.
to make it handicap accessible. Right?
Correct. We definitely work with other people in the community, other businesses, I should say, in the community. We call those partnerships. We necessarily, a partnership doesn't mean that we have any like business connection, like there's no any legal or financial gain there. It's just we have developed a relationship and we call them a partner, and we know that they're going to treat those patients with the same level of care we would have, give them. And so we would recommend that company to them and work with that company as far as the needs of that client or customer.
And that's very important. Charlotte and the surrounding markets is a big, huge, population-wise, very big. We're very fortunate. We have some of the greatest retirement communities and healthcare providers in the Southeast, let alone in the nation. But a lot of us know each other.
Yeah.
And they refer out to each other, not for any monetary gain in any form or fashion, but to help the client, which, frankly, you can't always get if you're buying a product from a big retail box.
Exactly.
They're going to give you that product, walk away, but a provider that's truly in the industry is working with many companies.
Exactly, we are. We're a resource. We're not just selling you something. We want to be. Our tagline is treating you like family. Yeah. So we've been doing it since 1983, and we really do believe that. And I think that's the one benefit, because we are a family-owned business and we're small enough. We want our staff to embrace that. We want to treat people like family, and I think that just people remember us for that.
Okay, and where are your store locations?
We have 2, and we have a 3rd one coming, so we're really excited about that. We have 1 in Charlotte, and we have 1 in Gastonia.
Wow.
But we have a 3rd one coming soon in Concord.
Wow.
Yes.
Wow, well, it's an exciting time coming into the good year of 2016, probably by the time we see this show tonight. And we really want to thank you, Jennifer, for being a guest here on our show.
Thank you.
Jennifer Reid, Client and Brand Development with Griffin Home Healthcare, speaking about DME. And we would like to thank everybody on the show tonight for joining us. Hopefully everybody's had a great holidays and are looking forward to a great 2016. My name is Phil Koch. I wish you all a very good evening.